Hi, my name is Susan, and I'm from Horizon Blue Cross Blue Shield of New Jersey. Horizon administers the medical plans for active employees, non-Medicare retirees, and retirees enrolled in Medicare supplement plans of the New Jersey School Employees Health Benefits Program, otherwise known as the SEHBP. Today's presentation will provide you with information about the 2021 open enrollment for the SEHBP. As you view this webinar, you may want to have a pen and paper to take some notes and a copy of the applicable 2021 Horizon SEHBP Local Education Employee Plan Overview and Comparison Chart, which is available at www.horizonblue.com/SHBP. You'll find that additional detailed information is also available at this website. During open enrollment, you may enroll, waive, change plans, add, or remove dependents. Children currently covered under the plan who turn 26 will be automatically removed from your plan on December 31st, and where appropriate, your level of coverage will automatically change from family to member spouse or from parent-child to single if this was the only child covered on your plan. This may also cause your payroll contribution to change. During open enrollment, children turning 26 can apply for COBRA for a maximum of 3 years or Chapter 375 coverage, which allows a child to be covered to age 31, provided that they are single, have no dependents, and live in New Jersey or are a full-time student outside of New Jersey. The premium for COBRA or Chapter 375 coverage will be billed directly to you by the New Jersey Division of Pensions and Benefits. If you have a child currently on your plan who turned 26 this year and is disabled, you may be able to continue their coverage as an adult dependent on your plan. Please refer to Fact Sheet 51 found on the New Jersey Division of Pensions and Benefits website. Don't forget that if you have a life event during the year, like getting married, have a baby, adopt, or lose other group-based coverage, you have 60 days to complete and submit an enrollment form. Coverage will be retroactive to the date of the event. However, if you don't submit the form within 60 days, you'll have to wait until next year's open enrollment. And just a reminder that dual SHBP or SEHBP coverage is not allowed. So if you and your spouse both work for employers that participate in SHBP or SEHBP, you can't be covered twice under the plans. If you're changing plans, adding or removing a dependent for the 2021 plan year, you must submit a fully completed enrollment form by the end of October. The forms will look similar to the illustrations shown on this slide. Don't forget to include dependent documentation for any new dependents that you may be covering. The dependent documentation requirements are noted on page 3 of the enrollment forms. And be sure to include your other currently covered dependents on the form as well, otherwise they may be removed from your coverage. If you're covering more than 2 children, check the box for additional sheets attached and then fully complete another form to include the additional children. The second form must be fully completed or it may not be processed by the New Jersey Division of Pensions and Benefits. If you want to waive your SEHBP coverage, you must submit a waiver form and include a photocopy of proof of your other coverage. Keep in mind that you must take or waive both medical and prescription coverage. You cannot take medical and waive prescription or vice versa. No dependent documentation is required if you're waiving coverage. Please note that retirees may change their plan no more than once every rolling 12 months. Retiree enrollment forms should be mailed directly to the New Jersey Division of Pensions and Benefits, but active employees should submit their enrollment form to their benefits office. Chapter 44 legislation became effective on July 1st of 2020. Regardless of which SEHBP plan that you're enrolled in today, all active employees and non-Medicare retirees will be automatically enrolled into the new New Jersey Educators Health Plan, known as NJEHP, on January 1st of 2021. For active employees who are eligible, if you'd prefer the NJ Direct 10 or NJ Direct 15 plan this year or in a subsequent year, you'd have to submit a fully completed enrollment form and be sure to list all dependents that you want covered. The form must be received by October 31st or an earlier date if required by your specific employer. But be aware that for active employees, the NJ Direct 10 and NJ Direct 15 plans may cost you significantly more out of your paycheck than the new NJEHP plan out of your paycheck. More on this later. Those of you who are hired on or after July 1st of 2020, you'll only be eligible for the new NJEHP for the 2021 open enrollment. Non-Medicare eligible retirees are only eligible for the new NJEHP plan on January 1st of 2021. All other SEHBP plans such as NJ Direct 0, 1525, 2030, 2035, the NJ Direct High Deductible Plan, and the HMO plans are being terminated on December 31st, 2020. As part of the Chapter 44 legislation, another new plan known as the Garden State Health Plan will become available on July 1st of 2021. And more information about that plan will be provided at a later time and during next year's open enrollment for the 2022. At this time, please refer to the 2021 Horizon SEHBP Plan Comparison Chart for local education employees from our website at horizonblue.com/SHBP to see which plans are available to you and how much you'll pay out of your pocket, sometimes referred to as cost share. As you receive services throughout the year, this comparison chart will look similar to the illustration shown on this slide. Let's start with your benefits when you use an in-network provider, which is shown in the upper section of the chart. All of the plans include in-network benefits, where you'll save money out of your pocket compared to using an out-of-network provider. For office visits and emergency room, you'll pay a flat copay, like $10 or $15 for an office visit, and emergency room copays like $25, $50, or $125. And just a note here that under all of the plans, the emergency room copay does not apply if you're admitted inpatient. In an emergency, go to the nearest facility without worrying about whether it's in-network. In addition, the plans include in-network out-of-pocket maximum, which can save you more money out of the year. When you pay in-network coinsurance throughout the year, and when I say coinsurance, think a percentage, for example, 10% for durable medical equipment. And if that amount out of your pocket, all those 10% add up to the in-network coinsurance out-of-pocket maximum of $500 under the new NJEHP plan or $400 under the NJ Direct 10 and 15 plan, you'll no longer be required to pay any more in-network 10% coinsurance for the rest of the year. The in-network total out-of-pocket maximum will include the in-network coinsurance that we just referred to, those 10%, in addition to your in-network copays like $10, $15, and $125. So if you pay in-network copays of $10, $15, and 10% coinsurance that adds up to $500 under the new NJEHP plan, or $400 under the new or the currently existing NJ Direct 10, or $6,840 under the NJ Direct 15, you'll no longer be required to pay any more in-network coinsurance or copays for the rest of the year. Under all of the plans, certain preventive services are covered with no cost share when you use in-network providers. Now let's talk about what happens when you use an out-of-network provider. So refer to the bottom section of this comparison chart. If you use an out-of-network provider, that is, a provider who does not have a contract with us under the Sehbp plans, you'll be responsible for paying an out-of-network deductible of $350 under the NJEHP or $100 under the NJ Direct 10 and 15 plans, and coinsurance of 20% or 30% in addition to the difference between what the out-of-network provider bills and the reasonable and customary amount, which could be significant. You should also note that the amount that a provider bills, which is above the reasonable and customary amount, does not accumulate to the out-of-network, out-of-pocket maximum. For all of these reasons, most people prefer to use in-network providers so they can control their costs. Under the new NJEHP plan, the out-of-network reasonable and customary amount is based upon what CMS, that is Medicare, what they consider reasonable and customary. Under the NJ Direct 10 and 15 plans, the out-of-network reasonable and customary amount is based on what Fair Health National considers reasonable and customary. Generally speaking, the CMS amount is going to be a lower allowance than Fair Health National. And lastly, keep in mind that the in-network and out-of-network, out-of-pocket maximums are tracked separately. If you use most or all in-network providers, the new NJEHP plan may be one of the most cost-effective plans for you and your family out of your paycheck and out of your pocket. However, if you typically use only out-of-network providers, you may pay more in cost share under NJEHP than if you were enrolled in the NJ Direct 10 or 15 plans. Please refer to the comparison chart for information about the plans available and their applicable cost share for a variety of services. In addition, you can find more details about the plans by reviewing the member guidebooks found on the New Jersey Division of Pensions and Benefits website. We suggest that you estimate the annual cost out of your pocket, that is copays, deductible, coinsurance, plus the amount out of your paycheck for each of the plans that interest you to see what plan makes the most sense for you and your family. To sum up, the major differences between the plans, it is the in-network office visit copays, the emergency room copays, the out-of-network deductibles and coinsurance, and how the reasonable and customary amount for out-of-network is determined. The prescription benefits may also vary between plans. Please refer to your prescription carrier for more details. We just finished talking about how much you'll pay out of your pocket in copays, coinsurance, and deductible as you receive services throughout the year under the various plans. Now let's talk about how much you'll pay out of your paycheck for the year. To assist you in determining the annual amount that will come out of an active employee's paycheck, the 2021 contribution calculator on the Horizon website is based on the information from the recent Chapter 44 legislation passed for the new NJEHP plan and Chapter 78 for the NJ Direct 10 and 15 plans. This calculator will look similar to the illustration shown on this slide. If you use our contribution calculator, you'll need to enter your appropriate employee type as local education and select your desired level of coverage, for example, single, family, etc., your prescription plan option, your annual base pay, and indicate whether you were hired before or after July 1st of 2020. The calculator will advise you which plans are available and, where applicable, the amount that will be deducted from your paycheck over the course of 2021. Please check with your employer to verify which prescription option applies and whether the Chapter 78 contribution or another negotiated arrangement applies to the NJ Direct 10 and 15 plans. If another arrangement applies, please disregard the calculator results for the NJ Direct 10 and 15 plans. Most employees will find a significant savings out of their paycheck with the new NJ EHP plan compared to NJ Direct 10 or 15. Retirees who are responsible for the full share or a partial share of the retiree premium can find the full plan cost, which includes prescription, at the New Jersey Division of Pensions and Benefits website. The rate chart will look similar to the illustration shown on this slide. As mentioned in a previous slide, when you use an in-network provider, you'll pay less out of your pocket than when using a provider that is not in our network. To find a participating provider, go to horizonblue.com/doctorfinder. When using our site, you can search by doctor, other healthcare professional, or hospital. Refine your search by selecting filters for distance, gender, and language. View maps and get door-to-door directions to a doctor's location. And create a customized directory for doctors and specialties you use most often within a specified distance. All of the SEHBP plans use the same network with about 70,000 in-network providers in New Jersey, in addition to a nationwide provider network with over 1.7 million providers participating in network. If you're searching for an NJ EHP or NJ Direct provider outside of New Jersey, scroll down to the Doctor Finder to find doctors outside of New Jersey. And when prompted, be sure to enter your plan as NJX, like New Jersey Extra, for all of the plans. The Amino provider and facility search is also available. There, you'll be able to search for in-network providers in New Jersey only, but it will allow you to search by symptoms, such as headache or high blood pressure. You can also book a medical appointment using Amino. See our website for more information. As mentioned, the NJ EHP and NJ Direct plans use the same provider network with over 1.7 million providers participating nationwide in network through Blue Card PPO. That's 96% of hospitals and 95% of doctors nationally that are in network. For those of you currently enrolled in an HMO plan, you'll now have access to this larger provider network beginning January 1st. You can also take your health care benefits with you when you're abroad. You'll have access to doctors and hospitals around the world through Horizon Blue Cross Blue Shield Global Care. We have convenient and cost-effective treatment options available to you. With all of our plans, you have access to lab services through our preferred labs nationwide with LabCorp and Quest. You also have access to in-network retail health clinics where on-site board-certified nurse practitioners can diagnose and treat conditions and prescribe medications. You can also receive treatment for common ailments like colds or seasonal allergies. Receive eligible immunizations through participating New Jersey pharmacies for vaccines including flu, shingles, hepatitis A and B, pneumococcal, and HPV. Be sure to give your medical plan ID card to the pharmacy, and they'll automatically submit the claim for you. To find a participating pharmacy for immunizations, visit horizonblue.com/SHBP-flu, all one word, SHBP-flu. Additionally, you have access to in-network urgent care centers when you need medical care to treat wounds, sprains, and other conditions that need immediate attention but aren't life-threatening. By using an in-network urgent care center, you'll only be responsible for your in-network cost share. If you do use an out-of-network urgent care center, you'll be responsible for the out-of-network deductible, coinsurance, and any amount above the reasonable and customary amount. You also have access to telemedicine at the touch of a button through the Horizon Blue app. In addition, you can ask your doctor if you can talk to them via video, chat, or phone. And if you use an in-network doctor for eligible services, you'll only pay your in-network cost share. If you use an out-of-network doctor, you'll be responsible for the out-of-network deductible, coinsurance, and any amount above the reasonable and customary amount. Eligible members can enroll in a direct primary care medical home, DPCMH, with Our Health, Paladina Health, or Sanitas, and get unlimited access to personalized care with no co-payments, same-day and next-day appointments for urgent issues, evening and weekend availability, little to no wait to see your doctor, on-site blood work, and basic medications for acute conditions, all at no cost. And if you're enrolled in a DPCMH and you're eligible for NJ Well, a well visit plus a follow-up visit with your DPCMH doctor equals an NJ Well biometric health screening and 700 points. An online health assessment is still required to earn the NJ Well gift card. We'll talk more about NJ Well in a moment. To find a DPCMH location near you and to learn more about DPCMH, visit the New Jersey Division of Pensions and Benefits website. The NJ Well program is for SEHBP active employees, along with their covered spouse or partner. Children of any age are not eligible for NJ Well. The NJ Well program year runs from November 1st to October 31st each year, so you may still have an opportunity to participate and receive an NJ Well prepaid card by earning 800 points in the program by October 31st of this year. To participate in NJ Well, you must complete an online health assessment worth 100 points on our website and complete and submit a biometric health screening, which is also worth 100 points. You must register for the required health screening in advance, and several options are available, including an at-home test kit. Additional points that are needed to earn the prepaid card can be obtained from activities such as online activities, coaching, and preventive screenings. Visit our website for more information about how to sign up for a biometric health screening and for other valuable information at horizonblue.com/SHBP or nj.gov/NJWell. We're pleased to introduce Horizon Be Fit for SEHBP members starting January 1st. Covered employees and retirees, a covered spouse or partner, and children age 18 or older who enroll in Horizon Be Fit can receive a $20, I'll repeat that, a $20 incentive for every month in which they visit a fitness facility or walk at least 10,000 steps for at least 12 days per month. And SEHBP members will also have access to virtual Horizon Be Fit at Home features to earn incentives and stay motivated to maintain their overall wellness. You can register for Be Fit at any time after October 1st so that you're ready to begin tracking toward incentives in January. The registration link will be on our website. All of the SEHBP medical plans include access to an annual routine eye exam for each covered family member, but only when using an in-network provider. Glasses, contacts, and frames aren't covered under any of the medical plans. However, we do have discounts available when you register through Blue 365. Blue 365 also offers discounts for other wellness products and services like vitamins, gyms, and more. Again, the link for Blue 365 is on the horizonblue.com SHBP website. All members have access to My Health Manager, where you can create a personal health record, take an online health assessment, and receive feedback on how to improve or maintain your health and more. We also have health and wellness programs and resources available for maternity management through Precious Editions. We also have free digital health and wellness coaching programs available for management of diabetes, hypertension, musculoskeletal conditions like back, knee, hip, neck, and or shoulder pain, and weight management through Livongo and Hinge Health. You may recall seeing information about these programs recently in your email or regular mail. You can learn more about these programs on our website, including how to see if you qualify and information to get started. Our behavioral health team is here to support you 24/7, 365 days a year. Call 800-991-5579, the number on the back of your ID card, or Horizon Health Guide, who will help you connect to the right source. You'll have access to urgent care within 24 to 48 hours, transition management, ambulatory follow-up, telehealth support, and education. Virtual telehealth solutions are also available with Livongo, Eleanor Health, Joyable, Workit, Caden, and Able2. Supportive care is also available for end-of-life issues. Joyable is a self-directed virtual service available to support your emotional well-being at no cost and can be done in the comfort of your home, on your phone, without anyone knowing that you're helping yourself to get better. Eleanor Health and Caden Health all provide virtual medication-assisted treatment for those experiencing substance use disorders, including opioid and or alcohol use disorder. Keep in mind that medications for opioid and alcohol use are considered the gold standard for treatment. Able2 provides virtual therapy and coaching for members with behavioral and medical comorbidities like diabetes and heart disease. It's used to treat depression, anxiety, and stress associated with comorbid medical conditions and life events. Check out our website at horizonblue.com/SHBP for details on these programs, resources, services, and more. We're pleased to continue to offer SEHBP members our enhanced concierge member services experience through Horizon Health Guide. Here are some of the services that our health guides are responsible for. I'll begin with service guides. They handle a broad range of member services such as primary care physician selection assistance, eligibility and benefits, payment support, claim status, provider selection, care management referrals, appointment scheduling, preventative care, and member education. Our expanded resources include nurses and additional staff with a clinical background. Our nurses provide 24/7 support and education on any type of medical condition. They also assess your needs to deliver recommendations on appropriate levels of care and are able to refer you to either care management or other health programs. We also have clinical staff who are able to coordinate your care with our care management team for any chronic conditions you have while undergoing a treatment plan. It's great when your care can be monitored and followed through on so that your medical path is easier and less stressful. Remember to register and sign in at horizonblue.com/SHBP. After you're registered and signed onto this site, you'll then be able to download the Horizon Blue app on your smartphone for quick and easy access to your information. On our website, you'll have access to view your coverage, claims data, and update other coverage information, which you should do at least once every year. You can also look up doctors, hospitals, and other healthcare professionals, view and print your ID card, access the NJ Well site, and more. You can also chat live with a Horizon Health Guide during business hours or email us your questions through our secure email and review frequently asked questions. Once registered on the site, We'll notify you when claims are processed, and we'll also email you health news and information such as wellness tips, reminders, and dates of upcoming webinars, events, and online programs. Remember to keep your email address current on our website to receive this valuable information. And once again, please remember to download the Horizon Blue app on your smartphone for easy and convenient access to your information. Just a couple of reminders. All active employees and non-Medicare retirees will be automatically moved to the new New Jersey Educators Health Plan effective January 1st of 2021. No action is needed on your part, and new ID cards will be issued. Your Horizon ID card will stay the same. If you're currently in an HMO plan, your ID card prefix will change to NJX. A change to the new NJEHP plan will likely mean that you'll experience a decrease in the amount taken out of your paycheck for medical and prescription benefits. Active employees who are eligible for NJ Direct 10 and 15 and want to enroll or re-enroll in the NJ Direct 10 or 15 plan will have to submit a fully completed enrollment form during October to their benefits department. And remember that you can also view your new medical ID cards on our website or on our app on or after January 1st. Find more information about SEHBP at the websites noted or by contacting your Horizon Health Guide. On behalf of Horizon Blue Cross Blue Shield of New Jersey, thank you for visiting this website or viewing this webinar.